you for joining us here, sir. So, first of all, we would like to ask you, according to you, what are the opportunities that present the healthcare sector today in India?
Okay, well, if we talk of the healthcare sector is not just, we are talking of the hospitals and the clinics. So there is, much more. If you see the whole gamut of healthcare, it has hospitals, your clinics, medical devices, pharmaceuticals, your medical value travel, your digital health, and many more, of course, home care. So healthcare is, has evolved over the last, let's say 10 years, and it has come to the present stage, and there is a tremendous opportunity in healthcare. And if you see healthcare overall perspective, it is in our country, the model is, you see the public and private healthcare. There are two main stakeholders, and 70% of the healthcare is provided by the private sector. And overall, if you see total, we have about 70,000 hospitals in the country, which includes your small healthcare, mid-sized and large-sized hospital. And nearly 90% of the healthcare is provided by small healthcare organizations, right? Especially you see that in tier 2, tier 3 cities, and tertiary care is majorly provided by private sector and in metro cities. So it is very fragmented. Actually, the healthcare infrastructure of our country is fragmented, and there is urban and rural divide. We all know that. Now opportunities are tremendous. The first thing I would like to mention is that the digital health, which is coming up in a big way now, and technology is transformed healthcare in our country totally. You know about the telehealth. We are talking of telehealth, and we are reaching to people in the rural area, reaching to masses, and various technologies which are being used. Digital health again has a the various the components of the digital health, starting from your WhatsApp to internet, and your IoTs, your AI, augmented reality, virtual reality, your telehealth, of course, is one major thing, and also your the remote monitoring devices, right? And your predictive medicine, precision medicine. So digital health is actually game changer, and we need to adopt digital health, because adoption of digital health is an issue which we need to take up actually. And people in the hospitals, their doctors are not very tech savvy. They are reluctant to adopt digital health, and it should be actually, if you see the primary, secondary, tertiary care, and across each specialty, each hospital, each health facility should have some component of digital health. Your electronic medical records, electronic health records. So these are, something which we actually, it will definitely, digital health will definitely improve patient care. It will reduce the cost. There are many benefits, just to name a few. So opportunities are tremendous. One is, I talked about digital health, and second is again the public-private partnership, which is already happening. And you see, public-private partnership is something without collaborating, without joining hands, no one can succeed. No one can achieve the goal or achieve its aim. So just to give an example, yeah.
Do you think the trust between industry and government has reduced tremendously, or there is still gap in terms of public-private partnership?
A very good question. See, the trust is a very important factor, and even if I am collaborating with someone, if a public-private collaboration or a partnership, and today it is not only public-private partnership, it is public-public partnership, it is private-private partnership, and of course public-private partnership. So the trust factor is very, very, very important. and you need to develop that trust so that you are more efficient in your working, and you can achieve your goal. Without having a trust in each other, that there is no business which succeeds without the trust. Even I am a care provider, the care seeker is a patient, suppose. The trust between the care provider and the care seeker, trust between the collaborators, among the collaborators. So trust is a very important factor, and your question was, I'll just come to your question, whether the trust between the government and the private is whether it is reducing or it's building up or it is the same. I think the trust factor is developing, definitely, though there are challenges. See, to have the trust between the two, you need to have a continuous dialogue. It is, you cannot work in silo. You cannot work, you have your own views and ideas, and your collaborator has other views and ideas. There is a conflict, so there should not be any conflict of interest, and continuous dialogue will solve and the issues and develop more trust. So it is building up, and there are various, if you see ABDM, they have about 131 integrators. So the government cannot work alone without having the private partners being pitched in. So this is one example I have given. So there are various examples. The trust is so important, and it is building up. It is building up slowly, and government is also working very hard to achieve the universal health coverage, and of course, and the private sector is also
on the trust factor, which it brings me to my next question on the adoption of PMJ and ABHA and ABDM in the private sector. Earlier, till a few times before, we were seeing some kind of pushback from the private sector in adopting these, be it ABDM or PMJ. Do you think it has picked up now? And what more what private sector needs more to adopt in a full way?
Well, if you see, this Ayushman Bharat PMJY has been into existence for 5 years now, and recently, and ABDM has been there for last 2 years. The NHA, the National Health Authority, which governs these two flagship programs of ABPMJY and ABDM, they celebrated Arogya Manthan very recently on 25th and 26th September, and the completion of PMJY, 5 years of completion of PMJY and 2 years of ABDM. So I attended those 2 days, and deliberations were there, and there were various stakeholders, stakeholders from different states. They participated. They shared their best practices, and adoption of PMJY. If you see the number, the figure, it says more than 40 CR. Adoption of ABDM, I'm talking of, more than 40 CR ABHA registration has been done. More than 2 CR HPR, healthcare facility, physicians registration, and healthcare facility registration, HFR, have been done. So this actually is not a very, which needs to improve, good figure, but it is, there are issues. I think to solve any issue, we need to, understand the problem of the private sector, the pain points of the private sector, and we need to have a continuous dialogue between the two. So that's important. And some of the states, there are 3 states, Delhi, West Bengal, and another state, they have not implemented PMJY scheme. See, because each state is very unique in the management of this these 2 flagship program, about regarding the rates, regarding the payment part. Like Uttarakhand is a fantastic example of making the payments within 15 days. I was listening to the health minister of Uttarakhand the other day, and what he mentioned was that if the payment is not made on time, then he will cut the salary from that department who is making the payment. So each state has to adopt the best practices, and rates, of course, if there are some rates which are not viable for the hospital, because sustainability is an important factor for the private hospitals. And they are for-profit organizations also, right? So, even in healthcare, you see different categories of hospitals are there, including your for-profit organization, not-for-profit organization, which are trust hospitals, charitable, so different types of hospitals. So, we need to understand how we work together and see that there is more and more adoption of these schemes.
Right, right. Thank you so much, Dr. Sunil, for joining us here at the Kaho Tech event. It was lovely having you.
Thank you so much. Pleasure. Thank you. Pleasure is mine.